I heard that you also have been successful to make it possible that already school children learning in Sweden now mental training techniques. Can you tell me something about this?
Yes, 1975, the first 6 years was between 70 and 76 was devoted to the national teams and Olympic teams, because it was a very good area to work out the mental training, to measure the effects. It's more easy there to measure it than in other areas. At the same time, it became known and it became popular, because when we went to the school in 1976 and made the first study, then we came from sport instead from a clinical area. Because if we had asked the children to lay down in the end of a sport hour, and then we will make the same as we do up in the psychiatric clinic, then we have been thrown out from the school. But now we can say we want the children to lay down and close their eyes, and then we make the same as athletes are doing before they are going to perform in a good way. And then it was acceptable, it was some desired thing, so it was very good to come from sport to school. Then we made one study for 6 years that became a dissertation. We measure the effect of very simple programs in mental training, just the basic programs, 5-7 minutes only. And we had it in the end of the physical education subject. And in spite of these simple programs, and we measure it from preschool up to high school level, the effect was very astonishing. Because of this very good result, mental training was brought into the Swedish school scheme in 1983, and it became a part of the physical education area. Then we have continued, so now it's much more than this basic training, and now we try to get it in as a more subject which should be an ordinary subject, not only a part of physical education, but a subject in itself.